This video focuses on the pathophysiology of stroke. Just to recap a little, there are two types of strokes: ischemic strokes, which occur when a blood clot blocks a blood vessel in the brain, and hemorrhagic strokes, which occur when a cerebral blood vessel bursts or bleeds. 80% of strokes are ischemic, so I'll spend a little more time on their causes. Now let's move on to the main topic of this video, the physiological processes that underlie strokes. Because ischemic and hemorrhagic strokes have different causes, they exhibit different pathophysiology. I'll start with the pathophysiology of ischemic strokes, then move on to hemorrhagic strokes. In the case of ischemic stroke, the formation of clots, known as thrombi, is fundamental. There are several diseases or pathologies that predispose patients to the formation of thrombi, the most significant of these being atherosclerosis. A compromised systemic circulation also plays a role in ischemic strokes. For hemorrhagic strokes, elevated blood pressure is most commonly the underlying cause. Let's start with the crucial topic in the pathophysiology of ischemic stroke. What exactly are the conditions in the body that lead to the formation of thrombi? Blood in the body is in a constant balance between coagulating factors, proteins that allow the blood to form clots and minimize blood loss in the event of an injury, and anticoagulating factors, proteins that keep the blood thin and prevent it from clotting in the body. When the balance is tipped in the favor of the coagulants, the blood is considered hypercoagulable, and the risk of clot formation and subsequently ischemic stroke increases. A scientist named Virchow came up with a brilliant triad to describe the conditions that lead to the formation of thrombi in the body. These three key factors are endothelial injury, stasis or lack of flow in blood, and hypercoagulability. The presence of any or all of these factors increases the chance of ischemic stroke. The most important of these factors, however, is endothelial injury. Endothelial cells are the cells that line the inner wall of all blood vessels. When we talk about endothelial injury, atherosclerosis is the disease that comes to mind. Atherosclerosis is defined as a thickening in the walls of large blood vessels due to accumulation of fatty materials. Atherosclerotic vessel disease is the most common way that arterial thrombi occur, and therefore presents a major risk for ischemic stroke. In atherosclerosis, injured endothelial cells in large and medium-sized arteries become chronically inflamed. Low-density lipoproteins, abbreviated as LDL, found in cholesterol, are retained by the injured endothelium and become oxidized. These oxidized lipoproteins trigger an immune response, attracting cells called macrophages. These macrophages become trapped inside the endothelial lining, forming what are called foam cells. Eventually, the body tries to heal this chronic inflammation, forming a plaque or fibrous cap over the area. If something, such as turbulent blood flow, causes the plaque to rupture, a blood clot can form, causing a blockage. The plaque can also break off and travel in the circulation. If it gets stuck in a blood vessel in the brain, an ischemic stroke occurs. Now let's draw a cross-section of an artery. I'm drawing an artery because clots formed in arteries rather than veins are the ones that most often cause ischemic strokes. There are three main layers of an artery: the tunica externa, tunica media, and tunica intima. The tunica externa is made up of connective tissue. The tunica media is made up of smooth muscle, and the tunica intima is made up of primarily of endothelial cells. The endothelium lines the hole or lumen of the blood vessel. Over a person's lifetime, the endothelial layer of their arteries often becomes damaged as a result of various stimuli. These stimuli, such as smoking and high cholesterol, are linked to various risk factors for atherosclerosis. As a result of this damage, the endothelial walls thickened in the complex process described earlier in this video. When the endothelial lining thickens, the lumen of the vessel narrows, increasing the chance that something like platelets, white blood cells, or large proteins in the blood become stuck, forming a clot and cutting off blood supply. A compromised systemic circulation and a weak heart can also increase the chance of an ischemic stroke. When the heart is weakened, blood does not flow as effectively as it used to. When the flow of blood is reduced, the chance that various clotting factors in the blood can interact to form a thrombus increases. A heart condition known as atrial fibrillation is also a major risk factor for stroke, making a person 5 times more likely to suffer one. Atrial fibrillation is defined as a condition when the top 2 chambers of the heart, the atria, do not fully contract. Instead, they kind of quiver, or fibrillate. This irregular contraction means that blood is not pumped fully out into the ventricles. Some pools and can clot. These clots can then be pumped out of the heart to the brain, causing an ischemic stroke. Returning to the previous diagram, now let's look at how a different injury to blood vessels can lead to hemorrhagic stroke. If the patient has high blood pressure, then their arteries are always under a lot of strain, since the blood pushes on the walls of the vessel. Eventually, these walls can weaken, causing a bulge called an aneurysm. These weakened walls are more likely to burst, especially if they continue to be put under the same pressure as before. If the blood vessel that bursts is in the brain, then a hemorrhagic stroke occurs. Hypertension is therefore a crucial risk factor for stroke and needs to be well managed to prevent weakening of blood vessels. So now, here's a brief recap of this video and the pathophysiology of stroke. What is the major underlying cause of strokes? Blood vessel injury. This can either be caused by high blood pressure in the case of hemorrhagic strokes or atherosclerosis in the case of ischemic strokes. When it comes to ischemic strokes, the formation of clots plays a key role. Thrombi are usually formed in atherosclerotic vessels or in the heart. These clots enter the systemic circulation and eventually travel to the brain, obstructing a blood vessel and causing an embolic stroke. That's all for this video. Thanks for listening, and check out my other videos on stroke, including its treatment.